So a sediment examination of urine is a microscopic examination. You centrifuge down preferably greater than 5 mils of urine in a tube, and you pour off the majority of the supernatant, so the more liquid part, and then you resuspend the small pellet that's at the bottom. Sometimes there's hardly any there. In the remaining supernatant, you take a drop of that on onto a clean slide. You apply a clever slip. You lower your condenser, and then you evaluate it. We look at urine sediment first on low magnification, which is 10x, and then we go up to 40x and we look at it. So things on 10x, we're looking for big things like eggs, so some larvae and eggs of renal parasites we can see in urine, and we're going to look for casts on low magnification. You can also see some crystals can be very large on 10x. And then we go to 40x and we look at cells and we look at other crystals and we look for smaller agents such as bacteria. So we've talked before about what are appropriate numbers of cells, and we say less than 5 per high power field, and that's for, of course, red blood cells and white blood cells. Anything more than that, of course, that is hematuria for red cells and pyuria, or just increased white cells for white blood cells. Of course, you can also see epithelial cells that can be completely normal. And I'm not going to go into a lot about epithelial cells. At casts, though, they are more abnormal. Some are normal, some are abnormal, and I'm going to kind of go through why we see casts. So casts are just what they sound like. They are essentially a cast of the urinary or of the renal tubule. And so the bad casts that we see that tell us that there's tubular injury, of course, and we've talked about this several times, are casts that are called cellular casts. Cellular breaks down and becomes granular casts. And granular casts break down and become waxy casts. And of course, they look waxy because of the cell membranes being lipid. And so you can imagine, right? So here's cell breakdown, cellular casts, and then they come out and they form these what look like essentially casts, which I'm doing a terrible job of this. There we go. So that indicates tubular injury, and those are the most significant. You can also have something called hyaline casts, and hyaline casts can be not good, or they can be not so bad. And so hyaline casts can be due to proteinuria. They are due to proteinuria. And this can be pathologic proteinuria, or it can be just due to the concentration of those normal tubular proteins. So before you go crazy looking at these, you want to check the dipstick protein. And you want to, of course, check the urine-specific gravity. And you want to check the patient's albumin and see if you have a protein-losing nephropathy, or is it more likely concentration of normal distal proteins. Now, crystals are probably the most exciting thing, maybe next to infectious agents, that we can see in urine. And I'm going to draw some of these out and I'll tell you what they are. Some of them are clinically significant, so I call those the deal breaker crystals, which means you really should be able to identify them because they're very clinically relevant for the patient. And other crystals like struvite and calcium oxalate dihydrate may have underlying disease in the patient, or they may not be all that significant. So this is our quick and dirty urine crystals. So calcium oxalate dihydrates, that's this first one here. We see them commonly, and we see them in patients with a low urine pH. They tend to form. They don't necessarily mean that the animal actually has stones, although sometimes it can be related, but not usually. So we see them relatively common in patients with acidic urine. Struvite crystals we see commonly in patients with, so here our pH was decreased. Struvite crystals we see with an increased pH, and they can form just when urine sits. Certainly we can see it in some cats that have urinary tract obstruction. They may have a lot of struvite crystals, although some of them may have a lot of calcium oxalate dihydrates. Of course, calcium oxalate monohydrates, that's one of our deal breakers, so I'm going to put some stars around it. And of course, this we see with ethylene glycol, as well as other oxalate type of producing things, and some of those are dietary. I mentioned this in class, so there's ethylene glycol. How I remember that calcium oxalate dihydrates, they don't kill you, it's because it's ironic and it starts with di, whereas calcium oxalate monohydrate actually looks like either a picket fence, so if your idea of death is suburbia, remember picket fence, or if you hate vampires, remember it looks like a steak. Bilirubin crystals just means that you have bilirubinuria, not that exciting. Another deal breaker crystal is ammonium biurate crystals, and we'll talk about ammonium biurate when we talk about the liver, and that just means that you have increased ammonia, could be from a portosystemic shunt or something else, so we'll talk about that later. Uric acid crystals, another deal breaker. We see this in Dalmatians, in bull terriers, and a few other breeds. It's an inherited abnormality. These form stones in low urine pH. So in acidic urine, these form stones, as do cysteine crystals. So that's the same thing, another deal breaker. So if you see these crystals, these animals are actually at risk of making stones and getting an obstruction. Of course, like the first 30 differentials for organisms are going to be bacteria. Remember that bacteria can be due to the method of collection, but if you have a lot of inflammation, so a lot of white blood cells, you have to wonder if it's actually related to a urinary tract infection. Cats, when they're older, may actually have bacteria without a lot of inflammation. There's numerous other diseases that can both either affect the kidney or the bladder, so the kidney worm, Diactophamma renale, can infect the kidney, the bladder worm. There's a specific bladder worm of cats and dogs, although very uncommon. Certainly a young animal with stranguria and hematuria, I would worry about it. And then there's other systemic diseases where we can actually see infectious agents in the urine. They're less common, especially fungal disease. The last thing to mention, although clinically insignificant, are things like lipid, mucus, and of course spermatozoa. We're going to practice recognizing all of these things in the UA lab in a few weeks.